Hi, my name is Andrea Sarich. I'm going to be talking about our project developing an adverse experience before pregnancy index and how it can be used. So unintended pregnancies have been identified by the U.S. Department of Health and Human Services as one of the most important reproductive health issues to date. Researchers have previously focused on how adverse experiences during childhood result in risky behaviors, substance abuse and use, chronic health problems, relationship problems, and premature death in adults. Early adverse childhood experience studies never really explored reproductive health issues. PRAMS, Pregnancy Risk Assessment Monitoring System, was designed to closely monitor maternal behavior before, during, and after pregnancy. Our study used a series of questions from the survey that focused on stressful life events or life conditions that occurred in the year before pregnancy. The purpose of the study is to understand how these adverse experiences before pregnancy ultimately influence the likelihood of an unintended pregnancy. So for methods, the study consisted of 2,967 Vermont women who responded to the PRAMS survey between 2012 and 2014. PRAMS is an ongoing population-based surveillance system that is utilized to understand behaviors and attitudes of women before, during, and after pregnancy. The information gathered by PRAMS is used to make changes in public health systems to improve maternal and child health. We selected a series of questions from the survey to create an adverse experience before pregnancy index. These questions were based on risky health behaviors, stressful life events, and experiences before pregnancy. Questions answered with yes were indicated with a score of 1. Questions answered with no were indicated with a score of 0. Scores were then added and ranged from 0 to 20. The index scores were analyzed using multivariate regression model to assess the relationship between the adverse experiences before pregnancy and unintended pregnancies. Maternal age, race, ethnicity, marital status, maternal education, and federal poverty level were all controlled for. Our analyses were conducted in SAS and Sudan. So the results. Here you can see that 39.8% of pregnancies were unintended or mistimed. Women under 20 years of age, those who are unmarried, have less than a college degree, and were less than 300% below the federal poverty level were more likely to have unintended pregnancies, as we can see with these values here. Over 1/2 of women with 3 or more adverse experiences before pregnancy had an unintended or mistimed pregnancy, while less than 1/3 who had the intended pregnancy had 3 or more. So after confounders were controlled for, in this table, you can see that the odds of an unintended pregnancy were much greater if a woman had 5 or more experiences, as shown by this odds ratio. So the analysis shows a strong relationship between adverse experiences before pregnancy and unintended pregnancy. We can see a dose-response relationship. As the number of adverse experiences before pregnancy increases, so does the odds of an unintended pregnancy. As we know, or as we don't know, no previous studies have really created this type of index to understand the relationship between these adverse experiences and rates of unintended pregnancy. There are some limitations to our study, mostly around the PRAMS questionnaire itself and the index. So PRAMS is self-reported information, meaning that the respondents can not necessarily always give us a honest response due to the biases surrounding different unhealthy behaviors, and also some recall issues, not really remembering when things happened, since it can all be a crazy time to understand and remember. Because the study is cross-sectional in nature, we can't really determine causality, so we only really can give a statistical association and risk. Events in the study happened before birth, so some of the events may have occurred during pregnancy, and we also only have information on live birth, not pregnancies overall, so miscarriages, abortion, that sort of thing. So it's not really known how much the events before pregnancy influence all unintended pregnancies. The index also has some limitations in that the timing of the events isn't necessarily specified. The scores also don't include which events result in each score. So it is unknown which events are more specific to unintended pregnancy. Research has shown that women who experience stressors before pregnancy have a higher likelihood of developing physical and mental health conditions. Because of this, it's really an important public health goal to address unintended pregnancy rates. For example, the Oregon Foundation for Reproductive Health created a model called the one key question. Healthcare providers can use or are currently using this model to address issues with access to contraception, but we're suggesting that they can also use a similar model to address these adverse experiences before pregnancy in hopes to prevent or reduce unintended pregnancy rates. By addressing these problems, they have the ability to have a profound impact on the rates of unintended pregnancy and future health conditions of women and potentially the infants and children as well across the state of Vermont.